that you guys will join me in a discussion as we kind of move through today. Can you guys see that okay? Nod.
Yes.
Okay, awesome. I do want to go ahead and apologize here up front. I will be flipping over to an audio call here towards the middle to end. I have to take my youngest to school. So I'm going to be on to answer questions, but you won't be able to see my video a little after, I guess that would be 12:30 or so. So with that, I'd love to just kind of dive in. I'm going to try and give you a little bit of background on kind of me, where I came from, and then my journey and my path to where I am now. And my hope is to do that in about 30 minutes or so that we can have plenty of time to discuss, ask and answer questions, whatever you guys would like that would be helpful. So with that, again, thank you for the introduction. I think that pretty much covers at least most of my roles here at Virginia Tech. I'm happy to talk about others as we go through if people are interested. So a little bit of background on me. You'll see this starts at 6 months old. I was born in Tennessee. I don't remember it, so I don't really count that in my background. But I grew up in upstate New York in a tiny little town called Youngstown, which if you look, I tried to show it a little bit here on the map. It sits basically where the Niagara River dumps into Lake Ontario. So it's pretty much as close to Canada as you can get without being in Canada. The picture that's over on the side here, you can see these people sitting at this picnic table. That was pretty much what my life looked like as a young child. We would be on the water most of the time. The landmass that you see across from that is Canada. So I could see Canada from the end of the street that I grew up on. Small little town, mostly apple farming. Didn't really have a good idea of what I wanted to do. In 8th grade when we moved from there to North Carolina, my father's job transferred him. He's a chemical engineer with DuPont for most, if not all of his career. And they transferred him down to the Research Triangle Park area in North Carolina. So sort of center of the state, capital of the state of North Carolina. And I did both my middle school, the end of my middle school, all of my high school career there, and then ultimately my college career was also in North Carolina. Graduated from Millbrook High School, was a multi-sport athlete in high school, enjoyed running, played soccer, both for the school as well as in travel leagues in the state, ran indoor and outdoor track and cross country. And then my real passion, which was springboard and platform diving, which I started when I was, depends on if you talk to my mom or my dad, either 6 or 7. I started diving competitively and continued that as I moved into college. So went to the University of North Carolina at Chapel Hill for actually all of my degrees. We'll walk through them here as we go, but my undergraduate degree from Chapel Hill was in applied science biomaterials. It is the precursor to the biomedical engineering program that exists there now. That is a joint program between UNC and NC State. As I mentioned, a large part of my life was sports, it still is to a large extent. Was a varsity diver for 3 of the 4 years that I was at Chapel Hill as an undergrad. Had my second of my 3 shoulder surgeries my sophomore year in college, and then ended up retiring from diving after that surgery. And so did not compete then my senior year. But that left kind of this gaping hole for me in terms of what I wanted to do and how I wanted to combine my love and passion for sport with kind of my innate desire to ask and answer questions. I've always been curious about how things work and why they work the way they work. And I was really struggling with how to combine those worlds. When I went to undergrad, my desire at that point was to work in the design and development of orthotics and prosthetics. And that's really what I thought I wanted to do. And the farther I got into the coursework, the less that seemed like what I really wanted to do. I wasn't going to have nearly the connection that I wanted with the people that I was ultimately helping. It was going to be a lot more lab-based work. And so midway through my junior year, I started probably about the same time that I retired from diving. I was having these, I don't know, I can call it an existential crisis if you want, but I wasn't sure what I wanted to do. I knew that I wasn't going to change my degree program. I was too far down that path. And so I was trying to figure out, what do I do with all the knowledge that I have gained at this point to be able to still ask and answer the questions that I want, and ultimately move to the career that I wasn't sure what that was yet, but I knew that it needed to be, and I wanted it to be in the science and math space. So I had a fantastic physics professor when I was an undergrad who was a nuclear physicist, and he offered me the opportunity to work at the Triangle University Nuclear Labs the summer between my junior and senior year. And I was pretty sure that nuclear physics was not my future. It did provide me an opportunity to work on a larger team for the first time, to get a little bit of insight into what it meant to be a piece to solving a larger puzzle. I ended up doing MATLAB coding, and then also some Visual Basic coding and a few other things that summer. Learned very quickly that coding was not what I loved and was not going to be my future. So you'll see a trend here as I walk through these. I spent a lot of time early in that process deciding where that was that I wanted to be, and tried a lot of things that ultimately I didn't enjoy. The next adventure that I took was in an orthopedics biomechanics lab, which was getting me closer to ultimately where I ended up. But it was a soft tissue lab. We did work in rat tail tendons, I guess we all did work in rat tail tendons, looking at tendon properties, a lot of material and mechanical testing. Ultimately, my first paper came out of the work that I did in that space on clavicular fractures and fracture fixation. And I learned it was not what I wanted to do. I didn't want to do animal modeling. I didn't want to work. It seemed too removed, I guess is the best way to put that. It seemed too removed for me from what I ultimately wanted to do, which was to see the impact of the work that I do on the individuals and the patients that we're doing all of this for. So again, that was the majority of my senior year I spent in that space, at least the first semester. And then I found what I call my home, which is where I've been ever since. So I happened upon a faculty member in physical therapy, actually, who did work in sports biomechanics. And he ran a research lab there, and he offered me the opportunity to volunteer during the spring term of my senior year. And I fell in love with it. I loved the fact that I could work with, well, in this case, it was athletes early on, and then also stroke patients, and then ultimately moved into the questions that I was interested in. And he brought up the idea of graduate school to me sort of offhandedly in a conversation during that spring of my senior year. UNC, much like Virginia Tech, has a version of a fifth-year master's program where you just stay, take a little more coursework, and do your master's thesis. And he offered me the opportunity to stay and work in the lab and do a fifth-year master's. So I rolled right from my undergraduate time. Literally a week and a half after I graduated from undergrad, I started my master's work again in his lab, with the understanding, or at least my understanding, that I was going to get my master's and then I was going to go get a job. I was going to go work in industry. That seemed like the best fit for me at the time. And I really truly believed that at the time. About halfway through that master's thesis project, I realized very quickly that wasn't the end for me, at least in terms of learning. I was given my master's thesis project, which is fairly typical in most master's programs. It wasn't a project that I necessarily had a real passion for. Obviously, it involved sport. It involved a sport I loved. So the idea of looking at soccer and soccer heading and the potential risk for head injuries was interesting to me. It was a modeling project, though. So it was a theoretical study that, again, solidified my knowledge that modeling was not the end of my career. It wasn't what I was going to do. And I had a few conversations with my advisor, probably not as many as I should have had, in which I said, this isn't what I want to do. How do I how do I get to a point where I can ask and answer the questions that I really want to ask and answer? And my advisor was a fairly straightforward individual, and he said, well, you have to have your PhD if you want to drive the research questions. And that, it was as simple as that. And then the meeting was over. And about a week or two later, you know, he said, so are you staying? That was literally our conversation. And I said, I don't know, what does that look like? What does that mean? And I didn't know. Like, I was, well, both of my parents were college educated. Neither of them, one had a master's, the other was a bachelor's degree. So nobody had ever in my family had really done a PhD. I had no idea what that meant, other than my father used to joke about the PhDs in his company who just sat around and thought all the time, right? So that was the only framework that I had. And that they made his work harder as an engineer. that was all I had. So we talked again for maybe a half an hour. And he said, it means you finish up 1 or 2 additional courses and you do a dissertation project. Again, I had no idea what I was getting into with that, but I thought, that doesn't sound too hard. That doesn't sound like a ton of work. Like, I've gone this far, I might as well try. And so agreed to stay. So I finished my master's work a little over a year, about a year and a half or so, and rolled into my dissertation project, which was a project that I was interested in. For the first time I really got to explore something I was passionate about, which in this case was a specific property on a running shoe that was leading to some anterior leg pain for a number of the patients that one of my committee members was seeing as a practicing physical therapist. I learned a ton through that process. I actually did switch advisors in that process. So while you'll see Dr. Yu was on both my master's and my PhD work, my primary advisor actually was Dr. Gross, which was a transition that I had to navigate kind of in the middle of that, right? Like changing, I still was in his lab, but he was not my primary advisor. So when it came down to answering questions, I was going to somebody else. And so there was a lot of dynamics in that I learned to work through. In the middle of that, I was offered a position out at Nike, and ultimately turned it down because they weren't going to let me finish my degree. I had to come then, or I was going to lose the position. And for me, that decision was one that I made because I was afraid I would regret not finishing. Right? That I would look back and say I was, you know, just had to finish writing my dissertation, and if I didn't do that, what was that going to mean for me long term? So I ended up turning it down. You'll see in a few slides I had the opportunity to come back ultimately and work as a collaborator with some of those same people out at Nike, and so it's been a great relationship, both as a colleague and a friend to a lot of the people out there. So I still think it was the right decision. Who knows what my life would look like if I had made a different one. I bring this up because I know most of the group that's here are graduate students, and everybody has a different path that you're on in terms of how long programs are and things like that. My students always joke with me that what I did was unrealistic, and potentially it was, but I do like to put out there that I finished both my master's and my PhD in 4 years, mostly because I was ready to be done. And there's a lot tied up in that, and I'm happy to talk about it in terms of the dynamics with my advisor, and that like I was just ready to go ask and answer the questions that I wanted to accomplish. We can talk about whether my work-life balance was healthy or not in this as well, but that was a choice that I made at the time. So I graduated with my PhD in biomedical engineering from Chapel Hill. Both, again, my master's and my PhD were both in biomedical engineering, which there is conferred from the School of Medicine. So it's kind of a different dynamic than, say, at Virginia Tech, where you're in a college of engineering. I was not in an engineering school. I was in a school of medicine. So the focus of our dissertations and our coursework was a little different than, say, in a traditional college of engineering. And that, I think, is what led me more towards the path that I ended up on, which was to spend ultimately 11 years at Duke in the K Lab, which is short for the Michael W. Krzyzewski Human Performance Lab, where we focused on understanding injury prevention, long-term health, and using rehabilitation models to improve outcomes in clinical patient populations. Again, you'll see for me that direct connection has always been there between the work that we do and how it impacts patients. Sometimes I'll say athletes, but most of the time right now it is patients. They may be athletes, but they're also typically a clinical patient. So when I think about my research in a global sense, I think of it as translational research, and that means something a little different depending on who you're talking to. So for me, when I speak of clinical research, it is the building and maintaining of teams of researchers that cross between the basic sciences, so whether that's engineering, biology, whatever basic science, and a clinical collaborator. So looking back on my career, there are very few projects that I have done that did not involve a clinical collaborator, whether that was an orthopedic surgeon, a physical therapist, an athletic trainer, to really back the ideas that we had into something that would be clinically useful. Answering a question that would advance clinical care or develop systems that would allow for our clinical partners to be able to better assess or better make decisions as they were working with their patient populations. There have been a few projects over the years that I've had the pleasure of doing, and I do that more now at Virginia Tech than I ever did before, where the knowledge and the opportunities that I had while I was at Duke have allowed me to build some collaborations that are a little more broad than just in the clinical space. And I'll show you some of those examples here in a few slides. But most of the time that I was at Duke, I worked obviously in orthopedics, did a lot of implant work, total hips, total knees, total ankles, ACL reconstructions, a little bit of work in the wrist. I'm really more of a lower extremity person, but I had a hand surgeon that was interested in doing some work, so we did that as well. So across a fairly broad spectrum, from pediatric patients who were 12 or 13 years old having an ACL reconstruction, all the way to our older adults who've had a joint replacement, so in their 60s or 70s, which again is part of what I love about the work that we do, is I get to talk and interact, again, not as much anymore, but talk and interact with patients across the spectrum, really understand and learn from them where their challenges are and how we can begin to address those, again, for me, through clinical intervention, mostly therapeutic intervention. So I was looking back, I always have trouble remembering if it's 5 or 6 years. So I'm in the middle of my 5th year here at Virginia Tech. I came in 2015 into the Department of Biomedical Engineering and Mechanics to run the Granada Lab. And it's been an absolute pleasure to be at Virginia Tech, to work across the College of Engineering on a variety of things. I'll walk you through a few of our projects here in a second, but I think the biggest draw for me to come out of orthopedics and back into engineering is the ability to work with students. At Duke, my lab was made up of undergrads who are volunteers and clinical learners, so medical students, residents, fellows. I didn't have graduate students. It wasn't an option because I sat in the School of Medicine, not in the main Duke campus. And so that was one of the big draws for me, was to be able to come back into engineering, but then 2, to be able to work with graduate students, to be able to do some more hands-on and didactic teaching, and to really see what I could advance without the constraints of some of the clinical confines that were put on us when we were in the School of Medicine. So it opened up my possibilities and the things we could look at. So a little bit of the work that we do here. Again, the Granada Lab sits in Norris Hall. There are actually 2 lab spaces in Norris. The main lab, as we call it, which is 208 Norris, which is what's in that picture. And then we have a second lab, which you'll see here in a few pictures, that's down in 133, what we call the basement of Norris, which is where the treadmill lab is. And we use the spaces for different things. It also affords us the ability to test more than one person at a time, because we can use both of those spaces for different things. So I would say that the desire to do translational research has not changed. That is still a big part of what I want to do. This particular image is part of a pilot clinical trial that we were doing in ACL reconstructed patients, looking at improving movement mechanics and side-to-side symmetry as a way of reducing the risk for a second ACL tear. So we know that when people go back to sports, there's roughly a 50 to 60% chance that they will either tear the graft, the replacement that was put in, or the other knee. And so our goals are trying to figure out how do we modify physical therapy and provide some objective metrics for our therapists in terms of being able to improve the way that people are moving and functioning before they go back into sports. And in order to do that, we've started to work with some companies and internally in the lab to develop new techniques for collecting data outside of the lab, which I guess is another area for us that we're really interested in advancing. And so this is you'll see a lot of my former grad students in these because we can take these videos and use them without worrying about HIPAA compliance and patient protections. But this is a video of Alex, who just graduated this past May, doing some HOP testing, which is a clinical test that's done almost routinely. And all that's used typically for determining whether somebody's ready to go back to sport is the distance that they hopped. And so we were working with Nobel Electronics, which is actually a German company, on the development of a single sensor insole, which is what you see in that center picture. And Alex is wearing those inside his shoes so that we could also look at how hard they're landing on the ground. So we could look at the loading profile of both their surgically repaired limb and then their contralateral limb or their other limb, to be able to provide some information that is more than just distance back to the physicians with regards to their risk potentially for a second injury. And that work is continuing, and I'll show you in a few slides some other parts of Alex's dissertation work that really has allowed us to advance into the clinical space. This is an image of the treadmill lab that I was mentioning. So we have an instrumented treadmill down there that allows us to do almost everything we can do in the main lab at set speeds or whatever. The treadmill can incline and decline, so we can look at the impact of different types of walking. There is a harness system which does also help us if we have a population that's a little less stable. This was a project done by another graduate student who was working, Kristen, who was working on developing a biofeedback training program for patients who had had a knee replacement. And so she was looking at whether or not she could change the way they were walking by providing them some feedback from the treadmill itself. And then the ultimate goal is to use things like the load sole, which are these single sensor insoles, to be able to do this either in the clinic or at their home to provide them immediate feedback in terms of how they're walking. So those are sort of in the Granada Lab projects, and just a handful of them. There's many more, but those are a handful. When I mentioned the fun and excitement that I get to have here at Virginia Tech in collaborative work, I put 3 of those projects here on this slide. The first one is a collaboration I have with mechanical engineering, where they're looking at developing energy harvesting backpacks for the military. I don't really work in the energy harvesting side of that. My role in those projects is the interaction and the human-centered design components of that. How does it feel? What is it going to do in terms of changing their efficiency with walking? When during the cycle do they need to be harvesting the energy? Those type of questions is where I come in to that work. This middle image here is a project that was recently funded. It's led by Dr. Rakakis and his colleagues, working on designing at-home-based programs for patients with stroke. Again, my role in that is not necessarily the stroke piece, but it's how do you design a clinical study? How do you translate the things that we do in a lab into a home or a non-lab setting? What do we need to do from a computer vision standpoint or a data collection on movement that's going to be able to provide actionable information back to a clinical population? And so that was recently funded through the NSF Smart and Connected Health program. And so we're ramping that project up now. Probably one of the most fun and one I've learned the most from, I think, over the years is a collaboration that was started a few years ago now with the I don't know what we officially call them, but the visual arts side of campus, who work over in the Moss Art Center in the Cube, designing a virtual reality environment. This one is specific for football. They were interested in doing some performance work in quarterbacks. I came into this, and now we're moving this forward with a current grad student in developing a virtual environment for soccer to use in my ACL patients to potentially develop rehabilitation tools and understand reaction time and changes in decision making after an injury, and how we can look at it more from a sports psychology standpoint than purely from a movement and engineering standpoint. So a lot of fun things that we get to do here in higher education that if I worked at a company, I would never have the opportunity to do. It does lead to a lot more commitments and a lot more kind of split focus, but I wouldn't trade it for anything. Again, just a few more images of the lab. A few more. There's Alex jumping again. He did that a lot as we were pilot testing things. And this is Charisse. Now, I almost said Hughes Oliver, but she's now Charisse Hill. She got married this summer. So, who graduated in May as well, and her dissertation, which was very, very interesting project looking at the impact that race has on gait mechanics and how that could lead potentially to racial health disparities. So you can see we kind of run this gamut for us across a spectrum, and it's really anything the grad students are interested in. I love to see where their passions are and help them move those projects forward. Sorry. For those that have never seen motion capture, this is what the data looks like when we get it. And so what you'll see is an individual landing, and then another image of somebody doing a squat. This is a post-op ACL patient about 6 months after. And it was part of the clinical trial work that we were doing to see if we could normalize the side-to-side load differences. So the blue arrow is the resultant ground reaction force vector. It tells us how much load each limb is taking. And you can see in squatting and in landing, there's an offload to one side that is typically their non-operative limb that they are overloading. And so our goal was to normalize that following a 6-week intervention. So just as one example of some of the data we're collecting. As I mentioned, this was a little piece to Alex's dissertation that I wanted to share with you. He worked along with a few others in the lab to develop an automatic tracking system. So you'll see this looks fairly similar to the video you just saw. There's a series of markers that we can track in real time, and it can tell us how someone's landing. Well, we can do that really well in the motion capture lab. The question is, can we do that in the clinic? And can we do it with simple technologies, in this case, a GoPro and an iPhone, to be able to provide at least similar information to our clinical collaborators as we can get in the 3D mocap lab. So, the next slide, it'll flip for me, was the last phase of his dissertation work, which required him to take a pared down version of that system. We learned what we needed to collect and what markers needed to be there into the clinic. This happens to be a physical therapy clinic, and collect the same information. So what we learned from this is that, in fact, we are able to provide both biomechanical, so joint position feedback, as well as you'll see that this individual has those same load soles in their shoes, so we can also provide a load feedback. So this project is moving forward again now that Alex has graduated and gone on to bigger and better things. We're continuing to progress with this towards the idea of having a commercial, knowing me, probably publicly available, but a commercial product for our therapists and clinicians to use in the clinic. I've talked for a long time, and it's about 30 minutes. There's a few slides I just wanted to share with you guys to give you a broader picture of the work that we do outside of just the research, which again is a huge part of what we do and a passion that we all share. The lab and myself over the years have been really engaged with and passionate about doing outreach work, from National Biomechanics Day, which is that large image in the center where we would bring in, this past year we couldn't because of COVID, but typically 100 to 150 high school students from around the area, and tour them through various labs in the College of Engineering, not just my lab, but a few. And for those of you who have been around a little while, some of the grad students will be familiar from a few years ago. And so it was kind of an all hands on deck. Grad students from across the different labs and the different departments all kind of joined in to help us make this day possible. The idea being to expose students to things they may not know anything about, not just coming to college and what does that look like, but also specifically for us, what is biomechanics and what does that mean and how can we work to help people improve their life. And then you can see some of these other images of even our younger kids, and this was an outreach event that was done as part of a national conference that I was in charge of, the outreach event in Rochester, Minnesota, near the Mayo Clinic, where we hung out for a day with kids at the Boys and Girls Club and ran them through a few different kind of fun research ideas and topics and had them design their own project and answer some questions. So for us, it's fun because I love hanging out with kids and seeing the fun things they come up with. But two, I think it's something that we have the opportunity to do in higher education that that industry does not do nearly as often, right? And I really feel like we have an impact in that way. I always bring forward the lab because they're an amazing group of students and future colleagues of mine. Some of these are now graduated, and I do consider them very much colleagues. This was from last year's 3.2 for 32, which we could not do together. We typically do it together every year. So everybody did it on their own and sent me a picture. The lab has changed a little since then because we have some people graduated and some new students that have come in. What I'd say is that we always try and make it a fun and exciting time together. We once a month have what we term as a lab fun event that they organize. I help support, but they organize it and it's things they want to do just so we can get to know each other outside of the day-to-day working that we do together, which right now I think is probably more important because we don't get to see each other every day. So we are still doing that now. I love to show pictures of my colleagues from across the country. I think that's, I don't want to say it's my favorite thing, but it's one of my favorite things about being in higher education is that I get to meet people from all over the world. I get to have great conversations with them. I get to learn from them. This bottom group of ladies down here, I've spent the last year and a half learning alongside of and from as part of an executive leadership training program. I don't know that I would have made it through what COVID has been for all of us without their support and knowledge that they bring from their various institutions. Some are in the US and some are in Canada. So what I'd say is building the networks and those collaborations. You know, some of these people I have known since, I can like point out a few, I've known since I was a grad student. Like most of this panel I've known since I was a grad student, and we met at a conference and you know, we room together, we hang out, we do things. This year's been kind of tough because we don't get to catch up. But, you know, always building that sense of community, whether that's here at Virginia Tech or in the broader community for you, is one of those really important things that I don't think we spend nearly enough time talking about. And I think my last slide that I always like to bring up is that I couldn't do this without, you know, the support of my family. So these are my, and you can hear my, you can hear my oldest over here in school. My husband and my two kids and my extended family. Also a huge part of my life and what I enjoy doing. So with that, Dr. Waller, I'm going to stop talking and I hope you can help me field some questions. And I will stay video as long as I can, and then you'll see me flip over to just audio. And again, I apologize for having to do that.
Thank you, Robin, for your presentation. And I'm sure the participants have lots of questions to ask. So if you have questions, please go ahead and put them in the chat. I will relay the question to Robin and we'll go from there. To get us started, Robin, you seem like you had multiple roles where you had to navigate graduate school. What was one challenge that you faced as a graduate student in navigating some of the myths that were happening as a grad student? Does that make sense?
I think so. You're sort of asking about just the challenge of what I'll call managing up to a certain extent and working with kind of the dynamics that existed in graduate school. Is that,
yes,
am I on the right path?
Yeah.
You know, I think probably the most challenge, there were a few, I'll be honest. It's a close tie for me between the work that I had to do with my advisor when I switched advisors was a tough one. And then also my advisor, so the Dr. Yu, who was my primary advisor in my master's and then on my committee, we did not always see eye to eye, specifically on the reason that I was doing things. And he just wanted me to blindly accept things, and that's just not, for those that don't know me, that's not who I am. I need to understand why I'm doing it before I'm going to do it. So, honestly, I did not probably handle it in the best way at the time. I was unyielding at times, and I would just keep pushing until I got the answer that I wanted, which is not a bad thing. And I expect that of all of my students now, that if they have questions, if they need something, that they just keep pushing until I give them the answer that helps them get there. I think honestly the thing that helped me through that advisor switch was that they got along with each other. So I was able to sit both of them down and say, this for me, I need, the Dr. Gross to be my advisor because I need the clinical component to this. I need him to help me understand the piece that I don't understand. And then they had a conversation without me and came back and said, okay, we've worked it out. It shouldn't be a problem. Right. So there was a little bit that I don't know. I could guess now that I'm on the other side of that, but I don't know exactly what that conversation was. Does that sort of help?
Yes. And I think we have a great segue. J.B. Pearson states, you talked about changing advisor during grad school. What motivated that, and how did that process work for you? I have an idea, but I want to hear what you have to say.
So, wow. How honest are we being today, Dr. Waller, about why I changed?
It is clear as water. Be honest.
Okay.
Transparency.
Okay. So the honest answer as to there were multiple reasons. The first one was that my working relationship with that advisor was not a healthy one. It was one in which he had a certain amount of dominance in that. And okay, we're just gonna be openly and honest because I don't really know who all is on this call, but I've said it to enough people over the years. He was as sexist as they come, and nothing that I said was going to be right. And so I needed somebody who would advocate for me as I moved through my PhD. And so that was probably the core of why I changed. And the clinical components were part of that, but it made it easier for me to push that when I wasn't happy in the environment that I was in. Maybe that was too honest and too upfront. That was really the reason that I made that choice. I don't know that I ever said that to him. I mean, I have since then, now that I'm on a little more of a level playing field with him. I have come back and said, some of the stuff that you said and did was completely inappropriate. And he still doesn't see it as inappropriate, but at least I had my time where I could say that to him.
But no, you are very transparent. And it seemed to me that you identified ways to manage up. You knew your voice, you knew something wasn't right. You tried to figure out how to navigate some of the unwritten rules of graduate school.
Right.
No one tells you how to do these things. So thank you for sharing that.
Can you do me a favor, Dr. Waller, and let on my phone, let me into the meeting so that I can switch calls for it. And then I'm happy to take other questions.
So I just let you in, and we have some more questions. Can you hear me?
I'm muted. Can you hear me? Is the question.
Yes, I can hear you.
Okay, then we're good. I'm ready.
Okay. So there are three questions in one statement. How did you manage conflicts of opinions between you and your advisor? How did you start collaboration with others? And how did you match your timeline of progress of projects and advisor and expectation? And I can restate those.
Oh, okay. Let me see if I can answer those one at a time. It's gonna get loud. I'm opening my garage door. Sorry. Um, okay, so let's start with the first one. Give me the first one again and we'll go one at a time here.
Okay. How did you manage conflicts of opinions between you and your advisor?
Okay. Not well. I will say that to start. It was not. I typically would send him an email. We'd set up a meeting. I'd explain why I thought what I thought. He would usually tell me I was wrong. And then I would let him sit and think about it for about a week and say, okay, so have you thought any about what we talked about? I still don't think that the way we were doing that was right. Can we have another conversation so that we can come to a consensus on how to do this? Or the other thing I would do was redo whatever it was in the way I thought was right, and then show him both sets of information and explain. Typically that would work. Again, I had to allow a little bit of time for him to be okay with what I was saying. Like, he wasn't going to give me, just had to give him a week. Usually it was a week. And so our weekly meeting, I'd bring it back up. And there was one I remember distinctly that took us about 3 months to resolve.
Wow.
And it was every week we'd talk. And I said, it's still not right. So for me, I had the ability to say, that's not humanly possible. Like, your body can't do what your software is telling me it does. And so I just kept at him until he finally said, okay, I found out where the error was in my code. I fixed it. He never said he was sorry, but he fixed it. So I took that as a win and I moved on.
Can you talk a little bit about how you start collaboration with others?
Yeah, that is a great question. It's more challenging the younger you are in your career. The farther you go, it becomes a little easier because you have a well-established an area of expertise, and so people will start coming to you, and that's a little bit easier. I think the way I typically start them is looking for someone who has an expertise that I could really use. And often it's an email. That's the first step. If I know somebody that knows that individual, I'll say, hey, would you mind connecting me to, so and so? I have a quick question I want to ask him. And usually it's a short email, like a paragraph that just says, something simple like, I read your paper on whatever, and I think it would be really interesting to see how that applies to the work that I'm doing. Do you have a half an hour that we could talk? Sometimes that would happen, all over email. And sometimes I would look ahead to a conference that I was attending. Again, now is a little different, but I would look ahead to those conferences and see who was there and reach out ahead of the conference and say, if you've got 10 or 15 minutes, I'd love to grab coffee. Can we talk about, this, that, or the other? And see if they would give me that time. And then usually they just built from there, where I share some information that I had that I thought would be useful for them. And then they would share back with me, like, thoughts on a grant, or, were they willing to join a team? Those kind of conversations. I would say, and this is not exactly in your question, Dr. Waller, so you can tell me to stop talking about it. But honestly, now, in my role now, I feel like it is my job, my responsibility, to help build those bridges for my students. And so what I suggest often for them is, if I can't provide those connections because it may be out of my space, I can provide them a link to somebody who's in that space. And so broadening your mentorship pool is also important. We talked about my two kind of primary people that I worked with in my graduate time. I can count more than 10 people, though, that from that time
I still to this day can call up and say, hey, what do you think about this? So building that broader network is one way to start those collaborations. And it may just be like, hey, I want to hang out and chat, and has nothing to do with research. And then it builds into something 10 years later. And I know that's a delayed gratification, but that's kind of how I've managed it over the years.
Awesome. Another question we have, Robin, the person said, you mentioned that your advisor helped point you towards your master's thesis project. Is this usual how master's students arrive at their thesis projects, or is it equally common for students to independently arrive at a project that they pose to their advisor?
My perception is that is highly dependent on the program. For the program that I was in, that was standard, that the master's thesis would come from the advisory team. That it would be a project that they either had going already or they were interested in, and they would just give it to you. Here, at least in my lab, I offer two paths to that. One is, if you have a project you're passionate about and we can get it done in the 2-year time span that you have, and if it's nominally within what we do, have at it, we'll go for it, we'll make it happen. If they come and they don't really know what they want to do, I start talking a little bit with them about their passion and what they're interested in, and then we'll build something either together, or I'll say, well, I had this idea a few years ago and I never did anything with it. Is it something that would be interesting? And then we build from there. So I think it is very dependent on your program. I've seen it work both ways.
Okay, thank you. Another question we have, how do you deal with a disengaged advisor? I'm learning as I go with fellowship applications and seem to have reached the limit of my advisor's patience this week, but ultimately need him to approve my speculative research plans. So far, people in my lab have been helpful.
Wow, that is a good question and a challenging one. Not, obviously don't need to know who your advisor is or any of that, but not knowing kind of what's on their plate, that's a tough one. I think that it sounds like you're under a fairly tight timeline. So I don't know that this answer will help much. What I know as an advisor is that I tend to know if somebody's putting in a fellowship application, and we have a conversation very, very early on about timeline and when I need, as the advisor, to get documents so that I have the bandwidth to turn them back around. At this point, based on where it sounds like you are in the process, I would suggest, whether, if you're able, get them on a Zoom call or meet them in person, depending on everybody's comfort level. And then just say, I really, really need this so I can move my fellowship application forward.
Can you say that?
And I don't know what the fellowships, I don't know which part you missed. Tell me from where, Trey, that I need to repeat.
The latter part of the funding.
Oh, yeah, as a reviewer, you can tell when a faculty advisor hasn't read the document, and it hurts the fellowship application. So
You went out. We didn't get any of that, Robin. Hello, Robin? We didn't get any of that.
His or her feedback
It's still breaking up.
before you put that in as nicely as you can.
Can you hear me, Robin?
Can you hear me?
Yes, I can hear you now.
Okay. For whatever reason, the elementary school blocks people's cell phone signal, so I got a little too close to the school. All right. I think the part that you guys maybe lost was when I was talking about the review process. Is that still like the
Yes, when they didn't.
where I need to start back?
Yes.
Yeah. So what I was trying to get across is that if your advisor doesn't review, especially the research plan, the review panel is going to recognize that, and that's going to ultimately hurt the fellowship application. So do whatever you can, phone call, email, meet in person, to ask your advisor for, one more review. Just tell him, like, you don't need, this will be the last, him or her, this will be the last time. I just need you to make sure that what I'm putting in here, that the science is sound, and that that a review panel isn't going to question what I'm doing. Again, it wouldn't be necessarily how I would handle it if there was a longer timeline. I think you definitely need to get at least a final read through. And if for whatever reason that your primary advisor isn't able to provide that because of other commitments, if there's anybody else within your department that would be able to read it, even just as a unbiased third party that may or may not be in your direct area, at least to say whether the flow makes sense and the science in general makes sense to a review panel, I think that would be helpful.
Okay. Another question I have for you is, how do you approach asking your current advisor when the advisor can get funding or a funded grant project for the student?
That's a tough one. So just to make sure that I'm understanding correctly, the question is about how to approach the faculty about getting, or whether there is a funded project on which the graduate student can be part or writing that type of grant. I guess that's what I'm trying to get clarification.
How do you approach asking your current advisor when the advisor can get funding or a funded grant project for them?
Yeah, that is a tough question, and that's a tough conversation to have. I think the way I would approach it, if I were in the shoes of a graduate student at this point, is to come to them with an idea as a start of, like, so I would like to see if we could get funding to support my time here. I found these, like, fellowship applications or these foundation grants. I think we could be competitive for them. Would you work with me to try and put one of those in? That at least starts the conversation without saying, hey, when are you going to get a grant so that I get, have some funding? They may turn around and say, I've submitted a grant, I'm waiting to hear back on it. And then you'll know kind of where you are. Often we as faculty I'm probably bad at this too, don't necessarily tell students when grants are in review, because we know that there's a chance they won't be funded. So we just kind of roll with it. So I think if you go to the advisor with kind of at least a start to a plan that says, I think we can be competitive for grants, at this funding mechanism, would you be willing to work with me on them? It'll open up that conversation in a positive way. To then be able to say, if they say, no, not that, but I'm working on a grant over here, and you can say, is there anything I can do to help? Would it be one that I could potentially be funded on if we were able to get it, the grant was awarded? I think being open and honest about that with your advisor is important. Just be aware that they may already have things that they're working on of which you are not aware, and kind of approach it from that perspective.
And a final question, I think it's a good question to end on. How did you match your timeline of progress of projects with the advisor's expectation?
Awesome question.
and one that is incredibly important to do. If you're speaking of me individually in my graduate career, I provided the timeline. He did not. And I said, here's my timeline. I'm going to get you things by, and I had a series of dates backed out from my desired graduation date. And I said, you know, I'm happy to talk about adjusting these. Will this work for you? And we went back and forth a little bit on certain things. And I said, how many publications do you want me to have? Do I need to have? Is that a requirement for me to graduate? You know, what is it that I need to do to be able to finish by date X, right? When I wanted to go. And then we talked about it. And then when he would start changing, most importantly, it was written down. So when he would start to hedge on timeline, I say, this is what we agreed on. If you want to change it, we need to modify the document. I recognize that that is not typical. What I guess I'm saying is advocate for yourself and that a little bit, and kind of think through when you want to be done, or when you hope to be finished, and then have go in with somewhat of a plan, not so firm that you aren't willing to give, and talk through with your advisor kind of what they're seeing and what they're thinking. They may know things that you don't about timeline. So just go in with here's a rough idea. Will this work? And then start that conversation with them.
Well, we've come to an end, and I want to say thank you so much, Robin, for this presentation and answering the questions. Scholars, we ask that if you have follow-up questions, do not hesitate to reach out to us. Definitely, there's a lot more we can discuss, but definitely provide feedback to us about other programs or activities you would like to see for Master Your Future. And again, thank you, Robin. We appreciate all the advice and your information that you shared.
Yeah, and I apologize again for cutting out and for having to do this kind of in an odd way today. But it's great to spend time with you guys. And if I can be of any help, please feel free to reach out. I'm happy to answer by email or chat with anybody.
All right. You all have a great day.
All right. Bye, guys.